Good evening and welcome to Unfiltered on SABC 3 and Channel 404. I'm Desiree Chauke. Thanks for joining me tonight. An evening of questions as South Africa grapples with growing numbers, albeit at a manageable rate, of coronavirus cases. To leave home or not to leave the house, many South Africans just generally feeling uncertain as information trickles in. The Minister of Health this afternoon confirming there's now 7 confirmed cases in the country. While the President has urged South Africans not to panic, there are questions about government's ability to handle the growing numbers. Also, in terms of your human rights, is it a violation for government to force or insist on a quarantine or self-isolation? Or is it recklessness for government to allow positive cases to self-isolate? We'll ask all of these questions. But right now, let's cross to our colleague, Griselda Lewis. She's in Sandton with the Minister of Tourism standing by. Tourism is, of course, one of the most affected sectors in terms of this outbreak. Griselda, what can you tell us at this moment?
Well, a very good evening to you, Desiree. Subsequent to the announcement by the Health Minister today that the numbers have risen to 7 in terms of the cases that have been confirmed of the coronavirus, a number of stakeholders within government are having separate meetings on the side, but all together, of course, culminating with the Department of Health on what South Africa's way forward should be. And you would know that tourism being one of the biggest sectors which is expected to be hit quite hard as a result of the coronavirus. The Minister has been having a stakeholder meeting since early this afternoon, and she's just concluded that and basically allaying the fears of South Africans, allaying the fears of those in the tourism sector that even though that at this point the tourism sector is expected to be hit quite hard, South Africa is looking at all plans at this stage to ensure that its citizens remain safe at this point. Let the Minister join me now. She has to leave. Minister, thanks indeed for your time this evening. You had an engagement with the sector, the tourism sector, from this afternoon. What exactly came out of that? Are they satisfied with what South Africa is doing currently to contain the coronavirus?
I think the sector mainly here, we were looking at how do we respond collectively, how to put our heads together and work together. And what we have agreed is that mainly as South Africa, we normally come out very stronger if we stand together. We've learned with many areas. And one of the things they're saying that we need to communicate more. We've been able to survive quite a lot of things and we've come out very stronger. And that's the message firstly. Secondly was to evaluate where we are in terms of either whether it's cancellation from activities related to tourism, how do we have a response? And we were looking at various scenarios, as I said earlier on. There are 3 scenarios that we had to look at to say the first scenario, if we are not going to have more infections, and therefore how do we respond, we can be able to recover. But we are testing certain ideas with them to say, what is it that you think we should be able to do? So it was quite informative because we had people whose businesses operate not only in South Africa, but globally. So they were able to tell us what has been the trend in other countries, what is it that are lessons that we can learn, we shouldn't do, what others have done. So the issues around, we looked at the issues around the travel bans, are they advising or not? The issues around whether we should limit the conferences or big events, whether we should also, even our own tourism Indaba, whether we should move it or not. So those were the feedback. So we'll process that as government, the feedback. Obviously, if there are still questions that we need to get, we'll get them, then take the report back to the IMC, which is chaired by Minister Mkhize, so that we can say this is what came out of the sector of tourism and the impact. We can't lie when we say it's not going to be impacted upon. It's going to be impacted upon negatively. There is a threat for jobs. And you know, tourism is one of the labor-intense sector. So part of what we are looking at is to say, are there things that we can do upfront to prevent and save businesses, and those are the things that we have to look at. There are areas that they highlighted, Griselda. The issues around them being able to unable to pay their loans, them being able to keep the staff, whether there will be support from Department of Labor in terms of business that are in distress. So those are some of the things, incentives, other way even raising to say, no, are you able to try and limit even on the restrictions of regulations? So that will not be able to decide as tourism, but we can take back to broader government to say, these areas, for example, in transport, this is what the industry, the airline industry, which is carrying the people, are here saying the people who are in the the car rentals, who are reporting to say actually the rental accommodation is expensive. We are likely not to be able to do it. So those are some of the feedback that we are getting, and we are able to look at it broadly, and we'll carry the message to broader community meeting, to broader meeting of the IMC.
Right. Minister, what would warrant, stopping tourists from coming into South Africa? I mean, we're on 7 cases at the moment. I know that the Minister of Health had indicated that a cabinet meeting would be held to decide what South Africa's stance is going forward. But from a tourism perspective, what would the situation to you be? What would the dire situation be for you?
Look, from our side, we're looking at globally what WHO is advising. WHO together with UNWTO, have advised to say don't isolate countries. So there's that message. But learn to be able to manage it in terms of either the people when they come, whether you restrict their movement, you manage them, you trace them where they are, instead of banning. So we look at other countries that have issued bans. What is it that they have done? And what are the measures? So those will have to be linked, because we are not health experts. We are not epidemiologists who know how the epidemiology moves or the virus will move. So our issue is to say, what is the information from our side that we can provide, and then collectively we can take a decision. So we are not yet there in the decision making, but we'll input towards that decision. And I don't want to, because I want to act within the confines of cabinet. I don't want to be preemptive of what cabinet will say, because tomorrow we'll say, no, Minister of Tourism didn't support this, so it means it happened outside the support. I don't want to do that. But what we do, we gather information so that it assists, so that government, when it takes a decision, it takes it from an informed point of view and has looked at all the pointers.
Right, Minister, I know that you really have to leave. Thank you very much for speaking to us this evening. I know you have another scheduled interview, the Minister of Tourism. Quite an important engagement, I think, that was taking place here in Sandton this evening. Obviously, the tourism sector, Desiree, expected to be hard hit by the spread of the coronavirus. South Africa standing on 7 cases, confirmed cases at the moment. And what's important to know, perhaps what we'd need to see over the next couple of days, Cabinet would need to decide, also according to the Health Minister, when we spoke to him a bit earlier on, Cabinet will need to decide on whether there will be travel restrictions going forward on the basis of how much further the coronavirus does impact on South Africa. So Cabinet would need to make that decision. The Minister also saying that she'll wait for that decision from Cabinet. They will take this input that they had here with the tourism stakeholders. Some concerns being raised about possible job losses in future if this continues. Also issues of whether they'll be able to pay their staff, and exactly what impact this will have in terms of specifically tourists that will be coming from those particular areas where there are high numbers of confirmed cases and deaths that are reported as well, Desiree.
Thanks a lot there, Griselda. I suppose it is all hands on deck, that conversation with the tourism minister, who's just had a multi-stakeholder conversation. Let's now welcome our guest, Zipporah Maisela. She's the mother of a child who's working in China. We'll also be joined later on by Dr. Martin Chalano, who's a doctor based in China. He'll be joining us on Skype. Later on the show, we'll also be joined by Giwizi Lubilo. She's a teacher based in South Korea. The numbers really growing at a staggering pace there. And also we'll be joined by Dr. Anban Pile from the Department of Health. He'll also be joining the conversation. He's the Deputy Director for General Health Regulation and Compliance at the department. We have invited the National Institute of Communicable Diseases. They informed us that they were unable to participate as they do not have an expert available. Zipporah, let's welcome you to the show. You are the face of that South African who's really worried on this day about, we're worried about contracting the disease here, but you have a child in China. How have the past few weeks been for you?
I thank you, Desiree, for being here. I'm so worried as a parent, as my child is in China. She went back there on the 29th of February. Before she came here before.
That was really in the middle of the announcements of this outbreak.
Yes.
Did she have to go?
She had to go because she said that she need to take her documents there in China.
Yeah.
So I'm so worried as a parent. But seeing that there's no job here in South Africa, I just let her go. But she promised to come back.
Yeah.
Yes, but she never did that. I'm still waiting for her to come back because there is this disease.
What kind of conversations are you having with her?
I asked her about the returning. She said to me that she will come back on the 1st of April because they keep on postponing the school at close in China, so they keep on postponing the reopening of the school.
So your child went over to China to teach.
Yeah.
There is no interaction with students, one would assume.
Yes. They are inside the room, and then what she said to me, she said they are doing an online teaching. That's what she said to me.
Is that so? So work is continuing, it's just not
Yes.
face-to-face?
Yes. They are not in contact with the learners.
Give us a sense of what the lockdown is like. What are they allowed to do and not allowed to do, and what kind of procedures do they have to go through?
2 weeks ago, I spoke to her, and then she said to me that she's going to the market to buy vegetables. And then I said to her that she must be careful. She must put on the mask. And then she said to me that she'll do that. When she came back, I checked her, and then she said when they go to the restaurant or supermarket, they check whether they have the fever or what. They always check them.
All right, we were talking earlier, and you indicated that you don't remember which part of China your child is in.
Yes, because in 2018 she was in, what's that?
You mentioned Beijing.
Beijing.
Yeah.
She was in Beijing,
So she's moved
and
from
then she
Beijing, which
moved
is the
from
safer
Beijing
part.
to other province because of the money.
Yeah.
Yes.
Yeah. How did she get to work, or she or he get to work in China?
She has a degree in social work. So she was looking for the job. What they said in social services, they said that they are still taking learners who studied with NASFAS first, then they will consider them after. So she just, I feel let's say, let me take this job in China.
Okay.
Because there's no job in South Africa. She ended up taking that job in China.
We're talking to Zipporah Maisela. She's a parent of a teacher who is based in China. Just to get a sense of the level of comfort or panic that people are going through in terms of the corona or COVID-19 outbreak. You're watching Unfiltered. Let's take a break. We'll be back in a moment.
We therefore want to announce at this point that there have been further numbers of people who were part of this team who were found to have been positive. It will be noticed that these individuals had come in as couples, and therefore we had asked them to be on quarantine already at the time when the first one turned to be positive.
The Minister of Health, Dr. Zweli Mkhize, they're giving that update this afternoon about the increased number of cases in the country. Later on the show, we'll be joined by a South African who's living in South Korea. South Korea already being at 7,382 cases and 40 deaths confirmed there due to coronavirus. And we continue to have different discussions about the outbreak. And one of the conversations we will have in a moment is with Dr. Martin Shirelo, who is a doctor based in China, who will tell us about how they're conducting their health work as it's becoming quite a hazard to be a health worker in any country where there is an outbreak. But let's continue now our conversation with Zipporah Maisela, who is telling us about your daughter who is in China, went there to work as a teacher and is now under lockdown. How often can you contact her, or how often do you speak?
I speak to her every day, but sometimes it doesn't want to connect. But I make sure that I talk to her every day.
How worried are you?
I'm worried that if maybe she can contract that disease, how am I going to get her back to South Africa? I'm so worried about that.
Yeah.
Because China is too big, and the only province that I know it is Beijing. I went there in 2018, so I don't know where she is now. So I'm worried about that.
Are you talking to other people whose children or relatives are in China, and what sort of conversations are taking place in this regard?
No, I haven't spoke to any of the parents yet.
Did you have a family situation before she left in terms of deciding whether it's a good time for her to go or not? I'm trying to understand why she would take the decision to go to China at a time when all indications were that there's trouble in China.
We tried to talk to her to say that she must not go there, but she said she left everything there. We spoke, it was me and my mom.
Yeah.
We spoke to her and my cousin also, but she never listened.
Yeah.
She was worried about the money also.
So is everyone, yeah.
She was worried about the money more than her health.
Money is the biggest concern around this outbreak, because people are now wondering, should I go to work or should I stay home, and what are the implications if I stay home?
I think the major thing it is that she also has a child. Maybe it is the problem that she chose to go there.
So it's those societal aspects that come into this conversation about the things that people have to do. But so far, she's healthy and she's safe in terms of the conversations you've been having with her?
Yes, she is.
Yeah.
But I can't say that she is. I know that she's safe, but I'm not sure whether she's healthy.
Yeah.
Because when you look at the symptoms of that coronavirus, they talk about high fever, coughing, and then if you look at the environment in China, there is so much pollution. I think it is so easy to contract this disease.
Yeah.
Because there is so congestion, so people will get sick when they. So I know the situation. People just cough.
But she's coming back in April.
This is what she promised me, that she will come.
Okay, you're watching Unfiltered, and we're having a conversation with Zipporah Maisela, whose daughter is a teacher who went to China seeking greener pastures, and there's now these concerns. So when you hear the Minister of Health, like on a regular basis, give updates about South Africans contracting the disease and the numbers keep going up, are you further concerned?
I am very concerned. I'm very concerned
Yeah.
about her and also the family. Because when you look at this person who has this from Italy, who has this virus, I'm not sure whether they discovered the virus at the airport or where, but I'm worried that what if maybe they cannot see, they cannot find out in the airport, and then she went home, she came home, and we also be in contact with her. What is going to happen to us? And also the 3-year-old son. what will happen to
It's a
her.
difficult decision to have
It
to make,
is.
isn't it?
It is.
Yeah. You're talking about the contacts, and there was a report earlier, I'm trying to look for it, which was talking about the number of people that this Italian traveling group had been in contact with. I'm trying to find that piece of information, and I will, okay, the one female had contacts with 16 people, one male contacts with 15 people, one male in KZN, 12 contacts, one male in KZN had 21 contacts. And by implication, it means all of those people that they have been in contact with are in some way or another affected. And this is where your worries stem from. Yeah. How's the family, the entire family feeling?
My mom is also worried because she's so close to her. She's worried. My cousins, my relatives are worried.
How old is
about
your
her.
daughter, if I may ask?
She's 27,
Yeah.
turning 28 in July.
A fully fledged adult who's at a healthy working age,
Yes.
and able and willing, and this comes up. Thank you so much for sharing your story with us. Zipporah Maisela has a daughter in China and worried like most South Africans. You're watching Unfiltered. Let's take a break.
South Africans should not panic. We should be alert so that if people either show signs of some of the symptoms, they should immediately be able to get medical assistance. And all our medical care people, whether in the private sector and in the public sector, are being informed that their alertness in identifying this disease must be at a much higher level.
The president there about a week ago asking South Africans not to panic. We're running a question this evening where we're asking you what your concerns are regarding COVID-19 and the outbreak in South Africa. Ngobeyalo Kotwayo saying we need a mobile clinic to be around people, teach them about this virus before it's late, special for rural areas. Those people don't understand anything about Kora Kora. Oh gosh, is that what it's called now? And we are scared. President not Ramaphosa, that's Matopompo, saying, is the government ready enough to handle it if it happens to get to the poorest communities? I think this is one of the biggest concerns, especially because one of the prescripts is that people must wash their hands thoroughly. And one asks, it begs the question, what about those areas where there isn't any water? Also, enough with the press briefings and put educational messages about hygiene out, as well as the right protocol to follow. And this is from Sumaya May. These are some of the conversations we're having tonight on Unfiltered. And at this point, we say goodbye to our SABC3 viewers. If you want to continue with the conversations, join us on SABC News, channel 404 on DSTV. All right, we're continuing with our conversation tonight. You're watching Unfiltered, and it's a conversation that everybody wants to have, but more importantly, we want more information, different aspects to this outbreak. The Minister of Health this afternoon announcing that there's now 7 cases, confirmed cases in South Africa, and we'll try and bring you a conversation that the Minister had with Aldrin Sampear during in the evening, earlier this evening. But for now, we continue with our conversation. We are, let me tell you, because we announced earlier that we'll be having conversations with a South African who's based in South Korea and also a doctor who's in China. Telephone lines are playing tricks on us, so we're really making an effort to get through to those two, and as soon as we're able to, we will do so. But let's continue our conversation with Zipporah Maisela, who is a parent her daughter is in China currently during this COVID-19 corona outbreak. Zipporah, we've been having this conversation, and it's important to have you here because, like I said earlier, you're the face of that South African who is really worried, either on the one hand about contraction or on the other worried about your family member, and in this case, your daughter who is in China. You were telling us about her limited lockdown. So she's not entirely locked up in her apartment, is she?
I'm not sure about that because
You were saying earlier that she's
can-
able to go out to the
Yes.
grocery shop and that.
yes,
Yes.
but I think that they are not allowed to go out maybe often.
Yeah.
Maybe if you want to go there, they are so afraid about maybe if they go somewhere, maybe the restaurants, they are checking when the temperature is high or what, they check something like
The
that.
thermal checks.
Yes.
So, in the conversations you're having with her, who regulates their movement? Who determines what time they can go out and how long they can go out for and such?
I didn't ask her about that.
Yeah.
The only thing that I've asked it was that, are you still inside the house? Are you allowed to go outside? And then she said they allow them to
Yeah.
go and buy something. Maybe if you want to go to the shops to buy something. So I never asked about who are those people.
How concerned is she about the food? Because the outbreak came out from a food market in Wuhan. How concerned is she about the quality of food that she's consuming?
When she went back to China, she took a food with her. She took a plenty of food. So I'm not sure whether this food will last her for long. I'm not sure about that. Or whether she went out to buy a meat or what. I'm not sure about that. But we asked her not to eat the food in China.
All right, so your concerns obviously growing about her safety, her health, when she will come back. These are the questions that most families around South Africa, especially those families who have relatives and children in China, are wondering about tonight. As a parent, what would you like to say to other South Africans who have similar concerns as yours?
Are you talking about the parents or?
The parents, relatives.
Okay. The only, the thing that I can say to them, it is maybe if we can form a parents maybe component to meet somewhere and talk about our concern as a parent.
Yeah.
Because they don't want to come, our children don't want to come back in South Africa because they said, if my child said, if maybe I come to South Africa, are they going to promise me to give me, are they going to give me the job or what?
Yeah.
But forgetting about her health, I don't know what the government will do. Because last time I learned that the government were taking other South Africans from China back home. And then they said some did not want to come back. So that's why.
Zipporah, thank you so much for sharing your story with us tonight. And we hope you will keep in touch and let us know when your daughter returns to the country.
Okay.
Zipporah Maisela is a mother of a teacher who's currently based in China and has partial lockdown, is fully experiencing this time of coronavirus outbreak, where every day is a different story altogether about how to approach life. You're watching Unfiltered. When we return, we'll talk to Dr. Letlape.
Even if you have symptoms, the treatment is not to the virus, it is to the manifestation of the infection. In other words, you can develop a pneumonia with a complication of this infection. We'll treat you for the pneumonia. Once you recover from the pneumonia, your body is strong enough to fight the virus on its own. When we treat the cough, we stop the cough so that you can settle and your body is strong enough to fight the virus on its own. If you've got a sneeze and so on and so on. We do it like that so that you can just understand that the approach, it doesn't necessarily mean now that Zolimkis is tested positive for coronavirus, take him to the hospital. It may not always go that way.
The Minister of Health once again there, and some of the things that were released by the National Institute of Communicable Diseases today, talking about their role in informing the public in terms of this outbreak, talking about collaborating with laboratories at tertiary and other institutions, and saying that should anyone showing COVID-19 related symptoms be tested, where the impact of disinformation and stigma around this disease should be avoided, and also informing and sensitizing the public, especially schools and rural communities, and any other messages to the public to allay fears and concerns. One of the big concerns regarding COVID-19 is hygiene. On any other day, Dr. Jose Letlape can talk about numerous other health-related issues in the country. But today you're here representing the Global Hygiene Council. What are they saying about COVID-19?
We're saying back to basics, simple hygiene. Washing of hands is a critical action to stop the transmission of infection. And it should not just be about coronavirus, it's about other infective organisms that can be transmitted.
Yeah.
It should be part of our everyday behavior. We should take the opportunity to wash hands when it is opportune.
I should tell our viewers that as you walked on set, I tried to extend my hand to try and shake your hand, and you were saying we should lead by example. It's COVID times. Tell us about that.
It's COVID times. I mean, you sit here, you interview lots of people, you are in proximity to people that are travelers. So I don't know where you've been, you don't know where I've been, you don't know whether I've just come back from China. I haven't made any declaration. Yeah. So let's err on the side of safety. And the notion that this is our culture, we're not simple-minded folks.
True.
And we can't be stuck on one aspect of our culture. There are many cultures
and at some point we have to walk the talk.
They do not shake hands. There are many of our cultures where people bow. People will go into a submissive position. They don't shake hands, but we do what is necessary to survive.
What is it about hands that make that part of the body more susceptible to contracting diseases than any other part of the body?
In fact, the hand is not susceptible, but the hand is the vector. Okay.
Unpack it for us.
When you cough into your hands, or you cough onto surfaces. Remember, when somebody is coughing, they'll have a spray that goes 1 to 2 meters. The virus is not airborne. It's droplet infection. So it's not in the air. It's in particulate matter. So proximity is important. But beyond proximity, it also goes onto surfaces. And it lasts for 12 to 24 hours on surfaces. So what do we do with surfaces? We touch tables, we touch door handles, we touch all over. So it'll move from the surface to the hand. And then after you've done that, how many times do we touch our faces?
Yeah.
Okay. Now when you look at the face itself, where the skin is not prone to infection. But our mouth, our nostrils, and our eyes, we have what we call mucosa, which is a thin lining, and the virus penetrates easily. So the hand is the transport. Get taxi. the virus.
In more ways than one, because taxis are also areas of people sitting together, huddled up in one area.
Well, taxis are transport of a different nature. But the point is, the hand is the vector. And for anything, you touch something, you prepare food without washing your hands, whatever you contaminate the food now, and that's how food poisoning occurs. That's how we have diarrhea in children. So remember, the hand is a vector.
Yeah.
So when you touch surfaces, when you shake hands, that's how you do it. So if you shake hands with somebody and they give it to you, you're not going to get it through the hand. You will use the hand.
Some social activists
to transmit it to your essential part, to your mouth, to your nostrils, and to your eyes. And
some
that's
social
how you get
activists, and I will pick out here, Nomboniso Gasa, on social media are up in arms today about the washing of the hands a bit, saying there are societies where there is no water to wash hands with. What are the options for people in those type of areas?
You know, are they suggesting there are people that have no water to drink?
Yes, there are societies like that in South Africa.
And how long would you survive?
We have been covering the water shortage story.
But how long would you survive without water?
When you have a water shortage, how do you decide between keeping clean?
You see, one of the challenges
and survival.
What I've seen as an advocate for hand washing, as an hygiene advocate, is that we sometimes undermine the creativity of people that live in hardship. They have no running water, but when they have access to water, they are incredibly inventive. I've been in societies where they take 2-liter Coke bottles, put water in them, suspend them, so that you can have an ability for water to run. They will scoop water with a jug and they will help each other. A little water on your hands, and you do that, and when you're ready, they'll sprinkle just enough water for you to rinse. So what we should be talking about is not talking against hand washing.
We should
be talking for giving people access to water, which is essential. Give people access to the soaps that are necessary. Yeah. So I mean, you can't be mad at hand washing. You could be mad and at an equal society, and that there are some communities that battle for the basics, and that becomes something that we can talk about in terms of improving access to water and people living where they have amenities.
He wears different hats in the health space, but tonight he's talking to us from the Global Hygiene Council with regards to the COVID-19 outbreak. Dr. Jose Letlape will continue this conversation after this break.
As long as we all, just follow the precautions that we've been getting, wash our hands, cough into elbows, open the doors carefully with like your elbows and stuff like that. And I think the healthcare in South Africa, we do have this. It is under control.
We don't want to get sick because a lot of people, they are suffering about this virus.
In the airports, you see harbor and stuff, people entering the country, that everyone is being checked properly. In the hospitals, everyone that enter or exiting the hospital has been tested.
Continuing that conversation about the coronavirus outbreak, and we're also looking at our social media responses to our question for tonight. What are your concerns? But this tweet is not on the show, but it's Simon Greenroad saying, is it true that AfriForum retreated home from their media tour of Europe and the USA cities because South Africa is seen as a safer place than Italy, the UK and USA in terms of coronavirus deaths and infection rates? Hashtag AfriForum. That's an interesting one. We'll follow that one up. But Matenji Dumshengu saying, my concern is, why don't they call all those who were in the plane to come forward, as they can test them before it's too late? I think that is being done. Khuzo Sekulisa saying, if it happens that we have to stay home as we're kept in households for a while. For those with medication which they got from clinics, how are they going to get help? And if it goes far and we have to go to the shops, also closed, obviously, even some services as well. I don't think we are there yet, but we'll keep following developments and bring these developments to you as they happen. Andries Totlanaiza Vivent saying it seems like the corona is quickly spreading to people day by day and no medication to cure it. I'm very concerned. Corona is more dangerous than Ebola. Well, we don't have any scientific proof there, but Mitepo Matsidi, so this is getting out of hand now. People's fear for their lives, and this will take us to that point of racism. People won't be free around each other, more especially those of different skin colors. So I suggest you help us by getting clear symptoms and vaccinations, even if it's not something strong, but something to make us stronger. Some of those concerns there, Nkandla Simamane saying better be safe than be sorry. The media is also omitting some of the valuable information, such as that the coronavirus has mutated and it's now having 2 strains, one that is mild and the other one is fatal. I think that is why there is that term that is called corona novo or new coronavirus. Dr. Letlape, you can correct us on this one.
I think part of the problem is that people are beginning to panic.
Yeah.
And people are creating their own stories out there. And one of the most dangerous combinations is fear and ignorance.
Which is why there's such a need for information dissemination.
But people are not listening.
Yeah.
The government has been ahead of the curve. We prepared long before we had any cases, because we knew viruses don't keep passports. And we have air traffic and people will come in. So we're prepared.
Even the World Health Organization is saying there should still be movement among countries.
Yes, and we should give the government credit that they started identifying the hospitals, notifying us which are the hospitals that would be designated, notifying us or giving us information. Now, part of the issue is that we in South Africa are not responsible citizens. We are anti this, anti that. The secret to curbing the spread is citizens that are responsible. Now, there are protocols that will be followed. And if you read what happens is that all these 10 South Africans that came from Italy, inside the plane, the officials have a map of where each one of them was sitting and who was sitting around them, who was within a meter of every one of those 10 patients. There's a manifest for passengers. We know who they are and where they live. And they would have been contacted to say, do you have any symptoms?
Yeah.
But if you travel internationally, it becomes your responsibility as well that I've been traveling. So if I get any symptoms of a flu, I must go to the nearest health center, to the nearest doctor, and declare that I've been traveling, I've just come back, and I now have symptoms of a flu. Can you please help me or test me? So we need to be responsible citizens, because remember, if you travel, given that this has spread to over 50 countries now, and the airports are interconnected.
The biggest concern right now is international travel. What about local travel?
Local travel
is not exempt.
It's not exempt, but it's not in the same league. If you go into airports, our airports will have the international component separate from the domestic component. Now, that is distancing
risk
of the different passengers.
Yeah.
Okay. And if we didn't have it in the country, there was no issue about the domestic side. Now that people have come in and they've been traced and they are being encouraged to self-isolate. When you self-isolate, you won't be traveling until you go outside the danger periods and you are being closely monitored. All those things should give people the comfort that there's absolutely no reason to be paranoid about these issues.
Right to Care tonight issued a statement where they're talking about HIV positive people and people with TB who are not on treatment, saying they're at a higher risk of contracting this disease. What are your thoughts about this?
There are people that are vulnerable. Anybody that has a major illness is vulnerable. So it's not just people with HIV, it's not just people with TB that are not on treatment.
Everyone is at risk.
People that have cardiac failure, people that have renal failure, diabetics that are not controlled. There are many, many people that would be at risk. And as the ministry has explained and the minister has been at pains to explain, even when we get seasonal flu, there will be warnings to say the young, the pregnant women, the elderly must get vaccinated because they are vulnerable. They are more prone to infection. It doesn't change with corona. It's still the same dynamics. Now, when you have people that work with a particular disease, they will be more acutely aware about the challenges that their patient group will have. And that's why Right to Care will speak to that situation. I mean, there's one patient that died recently in one of the countries, and the key issue was that person had cardiac disease. So he was a person who had a low immune system, was not well, and all those people.
And those are some of the questions we need to be interrogating as we start to require more information about the impacts of coronavirus. Thank you so much for talking to us tonight.
But I think the key issue, and for me, I thought we were going to talk about hygiene, washing of hands, the connection to surfaces, the fact that people must wash their hands properly. It's not just rinsing them. It's not a 3-second job. It's a 40-second job. Sing happy birthday 2 times, you've done a good job. You have different parts of the hands, the palms, the backs, the spaces between the fingers, the thumbs, the bases, the wrist, and the finger beds. Attend to those areas. And if people want details of how to wash your hands properly, they can go to the website of www.dettol.co.za. Go to washing of hands and you'll be taken through the proper hand washing, the proper steps of washing hands properly.
And you might just save your life.
Oh, not only will you save your life, we will collectively save the nation.
And we have to end it there. Thank you so much for coming through tonight, Dr. Kgosi Letlape. That's Unfiltered for you tonight. Thanks for joining us. Till next Monday. Goodbye.